Hi, I'm Dr. Iva Lloyd, President of the World Naturopathic Federation. It is my great honor to be asked to speak at the 4th European Naturopathic Symposium. Let me just share my screen. So what I want to talk to you about is what we think lies ahead for the global naturopathic profession. So when we look at what the goal is of the WNF, three things really. Looking at the naturopathic profession as being recognized as a contributor to the WHO, the World Health Organization Sustainable Development Goals, and the criteria set out in the Declaration of Astana. To ensure that the naturopathic profession engages in respectful collaboration amongst all systems of healthcare while maintaining its core foundational basis, and that's really important, and that naturopathic care is widely accessible and affordable. When we look at how we might achieve that and why we think that those are feasible goals for us to aim for, we're looking at some of the healthcare influences that we can recognize. Part of it is the health status of the population, the growing rate of antimicrobial resistance, non-communicable diseases, chronic diseases, all things that the naturopathic profession does well. The pandemic, how we were included and not included in the pandemic. Looking at local, regional, and national governments, monitoring their recognition of naturopathy, the regulation, and how they're included, international bodies and directives, looking at patient diversity, demand, and acceptance, and really being aware of the fact that patients are increasingly looking for naturopathic care, looking at other systems of healthcare and their level of professional formation, funding, and very much when it comes to the naturopathic profession, and we're looking at things that influence how a healthcare profession moves forward, it's looking at our educational standards, our regulatory standards, and regulatory status globally, how we've codified knowledge, how we use knowledge, which is called knowledge mobilization, and then the research that we have and that we need to have. So if we look at the naturopathic workforce globally, this is what we discovered in writing the health technology assessment. That the healthcare, that naturopathy is a distinct system has been a distinct system of healthcare for over 120 years. It is the most common traditional complementary profession globally, with a presence in all WHO regions. And that's unique to the naturopathic profession, and we sometimes forget that. There's over 108 countries that have a naturopathic workforce. The naturopathic workforce engages in, we predict about 5.5 million patient visits a month. There are 34 countries with statutory regulation for their naturopathic workforce. What we have really also discovered is the consistency and philosophical approach, philosophies, principles, and theories of the naturopathic community. There's a core set of naturopathic modalities, therapies, and practices, and that there are different areas of expertise in different world regions. And we really are looking to embrace that and understand that to a greater degree. One of the things when we look at how the naturopathic profession moves forward and our acceptance, this is an outline of professional formation. And everything in green are things that we would say we do well, that we have an understanding of, and we're pretty good where we know where we are in the naturopathic profession. We have our core vision, philosophies, theories, and principles. We have academic institutions, and as you know, we're working on that to make sure that we have the two distinct programs and we recognize both of them and support both of them. We have professional associations around the world, and we're working on regulation and increasing public demand. Lots of conferences such as this and other conferences, and access to safe natural health products, which is a struggle in some countries, but that. So the two outer blue columns are areas that we think we need to really embrace so that we are part of the greater healthcare conversation, as opposed to just working within our healthcare, our own system, which is spending more time codifying knowledge like we've done with the health technology assessment, and really building external alliances and collaborating with other systems of healthcare, and working to be a bigger part of the greater healthcare conversation. So what does it take to be a bigger part of the healthcare conversation? These are the 7 things that we have recognized. One is recognizing windows of opportunity, having and staying within our own consistent narrative, strong external alliances and collaboration, understanding the risks for the profession and addressing them, supporting research, disseminating information, and having an intentional focus to be part of the greater healthcare conversation. So when we look at windows of opportunity, these are some of the things that the WNF has done. And we encourage every individual naturopathic practitioner and every naturopathic organization to look at it from their perspective as well as to what opportunities are out there that they can take advantage of. So the things that we have done is we participated in the Global Conference on Primary Healthcare, resulting in the Declaration of Astana, WHO working groups whenever we've been asked, and that has been often. Our response to the pandemic that I'm going to talk about, and then just being involved in the traditional complementary and integrative healthcare declaration and collaborative. So in the Declaration of Astana, when that happened in 2018, it really highlighted the important role that the naturopathic profession has, because they identified that the healthcare profession globally should focus on prevention, lifestyle medicine, and determinants of health. They should focus on non-communicable diseases, diabetes, heart disease, all of the lifestyle-based diseases and chronic diseases. They should treat the whole person and engage with patients as part of healthcare and focus on increasing health literacy. When we, John Wardle and myself, were part of this meeting, we really recognized how key the naturopathic profession is, because we already do this. This is an area that we play and that we work in as part of our healthcare. So it is about looking and saying we need to ensure that we're part of this conversation. The other WHO working groups, and just being part of the WHO conversation, especially as it relates to traditional and complementary medicine. So there's been a number of work of benchmarks and consultations that the WNF has been asked to participate in, and we have. When the pandemic came, the WHO had a meeting looking at the role of traditional complementary medicine with respect to the pandemic. And as the WNF attended that meeting, and as a result of that meeting, we naturopathic researchers around the world wrote 10 different rapid reviews looking at the role of key natural health products with respect to respiratory infections. And they were published in the Advances of Integrative Medicine. And it really did highlight the key role that we could have. As a result of that, a number of the rapid reviews that we wrote have been quoted many times and have been used as a part of backing of a lot of other research. What we also did with the WNF is we wrote a white paper on the role of the naturopathic practice within a global pandemic, and we sent that to ministers of health around the world. And we received a number of responses back. Even still, as all of you know, the naturopathic profession globally did not have a huge role to play within the pandemic, for varying reasons. So one of the things the WNF did in collaboration with the Canadian College of Naturopathic Medicine is we started a live review of natural health products that have been researched with respect to COVID, whether it be the prevention, treatment, or the treatment of long COVID. It's hosted on the WNF website. It's updated monthly. We've committed to doing this for a year. In March of 2023, just recently, actually last week, there was an interim report that we wrote that just got published in the CAND journal. And the reason behind this is we recognized that it was important that the naturopathic profession have a significant voice in the conversation of NHPs, natural health products, and natural treatments with respect to the pandemic. And this has been a great resource for us and has allowed us to have a voice in an area where we really, for the most part, did not have a big voice. So I encourage you to check that out. The other thing that's happened over the last couple of years, and a number of you have chosen to be sponsoring or members of, is the Traditional Complementary and Integrative Healthcare Collaborative. And it's a consortium of different organizations really looking at supporting the TCIH professions globally and having a broader voice. So that is one of the other things. And the naturopathic profession is seen as leaders in this collaboration. So that's the first thing, is recognizing windows of opportunity. And the WNF is always looking for other windows where we can ensure the naturopathic profession has a voice. The next thing is to ensure we have a consistent narrative. Part of that was the health technology assessment. And then the other one is the naturopathic key messages, which came out of the healthcare, which came out of the NHT. And one of the things that we found with the HTA is the fact that says it really does allow us to highlight the key areas and the key questions that policymakers make, and to allow people to say, this is the information you require when you're asked those questions, if you're working with the government and those sort of things. And it looked at the research, and it really gave us the ability to say, this is how much research there is in the naturopathic profession. These are the areas that it covers, and this is how it positions us within the profession, within the greater healthcare profession. So when we look at key naturopathic messages, through the HTA, through a number of different things that the WNF has done, we have written the naturopathic key messages, which is on our website. And we encourage people to modify it for their country to fit what is going on in their country. But it allows us to really say, we are leaders in preventative medicine. We are leaders in the prevention and management of non-communicable diseases. Based on the research we've done, 3 out of 4 patients visiting a naturopathic doctor or a naturopath have an NCD. We have a significant role to play with respect to increasing health literacy around the world. And part of it is looking at that says that we are leaders in patient-centered care and whole person care. So the key messages are there to help people. It's broken down by category, and we encourage you to use that. The third thing, when we're looking at what does it take to be part of that greater healthcare conversation, is strong external alliances. There's a number of different groups that every organization can be part of, whether it be, diabetes associations, or, local gastrointestinal groups, or even building alliances with acupuncture and homeopathy and other professions within your area. So that's part of the area that the WNF has recognized is probably the most lacking in the profession, is we now need to go outside our profession and work with other external groups. As a result, or after doing the health technology assessment, one of the things we did is we did 4 white papers, one on non-communicable diseases, so NCDs, type 2 diabetes, hypertension, and mental health. We intend to do 2 other ones after this. This is, the white paper allows people to then approach these groups and to say, this is why you should include naturopathic care as part of your care. So we're here to provide resources that may help you in doing that. So all of that information is to say that that's what we need to do. Within our organization, the main things that we need to do is we need to look and be really honest and say, what are our primary risks? And these are the things that have been identified in the health technology assessment, and that we also know when talking to practitioners, these are some of the challenges. One is rogue practitioners. So this is where we look at it that says every naturopathic organization needs to have guidelines to say, this is what it means to be a naturopath in our organization, and to have guidelines in place that ensure that the naturopathic workforce stays within the guidelines that your organization sets. The lack of title protection has hurt our profession because we have people calling themselves a naturopath who haven't done the appropriate training that we view is important for each country. So that is something that we're always working with. The misrepresentation in naturopathic care in social media and that sort of thing. We have a social media guide that helps practitioners and organizations with respect to that. The unlicensed versus licensed naturopathic practitioners, especially in those jurisdictions that are going under regulation or that are in regulation and that practitioners are not necessarily following. We talked about the misleading media. And the other thing is recognizing that there is a distinction between naturopathic and natural medicine. And not that one is better than the other, but it's recognizing that there is a distinction. And what we're looking at doing is getting so that we can say, this is what naturopathic is. And it is part of natural medicine, but there is a distinction between that. So even from an educational point of view, is recognizing those differences. One of the things that is required and is going to be increasingly more required is supporting naturopathic research, having naturopathic research. So some of it is in the health technology assessment in the key messages. The profession often gets, quote, accused of not having research. And we need to change that narrative because that is true a number of years ago, but not quite so true now. So we encourage people to look at the key messages, and we encourage people to recognize that the naturopathic workforce have demonstrated sustained commitment to codifying and synthesizing research. The other thing is that when we look at it, which is why we say the narrative might have been true in the past, but not so much now, there's a tremendous increase in the amount of research that's being done on an ongoing basis in the naturopathic profession. So this just shows that over the number of years, based on the bibliometric analysis that we did back in 2018. The other thing when we look at research, we really want people to recognize that every aspect of research is important. And when I think of traditional research versus research by the profession or done on the profession, this is just something, when I think of it, how I look at it is to say that people have the sense that we're moving away from traditional. But if you're looking at it as a pie graph, it's the fact that says that there's just so much more growth in other aspects of research, whether it be research done on the profession, borrowed research, which means research done on herbal medicine or homeopathy or acupuncture or nutrition. All of that is information that our profession uses to support naturopathic care. So sometimes it's just recognizing that the percentages are going to change, but every aspect of research is important. So what are the next steps from a WNF perspective? One is changing the narrative, providing you information so you can support that narrative, looking at building research capacity internationally. And that's one of the things that we will be talking about in the General Assembly in September in Switzerland, supporting and aiding the dissemination of naturopathic research, looking for research champions in every country where we can really help facilitate the building of research capacity internationally, encouraging research studies, really supporting research on every level. The other thing is disseminating information. The WNF has created over 25 documents. They're all on our website. We really encourage people to be aware of them, to look at them, whether it be the white paper on naturopathic history, philosophy, and principles, the health technology assessment, white papers that we wrote on NCDs. We really are trying to give you as much information as possible so that there's not as much duplication. Not everybody's doing the same work. The website we have on environmental toxins and on AMR, all of that. And then the other thing is the WNF social media, and recognizing that what we're doing from that perspective is to sharing the information of the naturopathic profession globally. And we encourage people to follow the WNF and to share information that comes out from your country so we can share it with the world. So we talk about other resources that we have is there's 2 videos that we have done, which are great to share with your community, to share on your website. They can be translated into different languages, those sort of things. As I talked about the AMR website, every now and then we highlight that in our social media, but we encourage you, especially if that becomes a topic within your country, is to focus on that. Same from an environmental concerns. As you've probably seen, we're busy focusing on the environmental concerns and the social media blitz for that. Part of the WNF, part of our goal is to ensure that the naturopathic profession are seen as experts with respect to environmental medicine, with environmental health care. So we'll be sharing more information from that perspective. So part of it overall, when we're looking at it, to say, in order for the naturopathic profession globally to have a greater role to play in the greater healthcare conversation, part of it is the fact that says, like I said, recognize the windows of opportunity in your country. If we can help, if the WNF can help in any way, then ask us. have a consistent narrative. Use the key messages that we've had, create key messages that are unique to your country, and really recognize that stay within that key consistent narrative, and that is always beneficial. The main thing that you will see from the WNF in the next few years is really looking at building external alliances, both within the profession where we have different organizations supporting each other and helping them in any way they can, especially with respect to education, but also looking at external alliances, both within the traditional complementary and integrative healthcare world, but also outside, especially as it comes to patient advocacy groups for conditions like arthritis and heart disease and diabetes, and then NCDs, the non-communicable diseases that we do so well, that we treat so well as a naturopathic workforce. So addressing the primary risk to the profession, we encourage every country and every association to look and say, what are our risks and how do we address that? Whoopsie, went too fast. Supporting research, disseminating information, and recognizing that there is a lot of information out there. So if you need information and you don't know if it's available, ask us and we will see if we can help. And most importantly, having an intentional focus to be part of the greater healthcare conversation. And that's key. So if we can help in any other way, if there's any other information that we can provide, please contact us. The WNF is here to support you in any way. And we really do believe that the time has come for the naturopathic profession to have a much stronger voice in the global healthcare conversation. And we're here to support you in any way we can. Again, thank you very much for inviting me to this symposium. I hope you have I'm sure you'll have a great conference, and I look forward to hearing more about it. Talk to you soon. Bye.